Hello, my name is Emily Foulkes, and I'm a charity director, a music and singing practitioner, a researcher and a trainer. I graduated 20 years ago in 2000 with a degree in dance, in contemporary dance, performing arts from Middlesex University. And over the course of my career, I've trained in complementary therapies, including massage, Reiki, chair massage, and have also undertaken lots of singing courses, as this has always been my passion since I was a little girl. I've trained more recently in mindfulness to become a mindfulness teacher and incorporate this into my work. I am a singer, a songwriter, and run choirs and have been running choirs for several years. I had a career for 10 years with youth music, where I was responsible for setting up and managing national programs which were around supporting children and young people in challenging circumstances through music, specifically through music mentoring programs and youth volunteering programs. I'm now a charity director for a small organisation in Cornwall, Kaimas Music, where we use music and singing to promote well-being, health and well-being, and also to support education and learning. In recent years, I've been really lucky to have been a bursary recipient for the MA in Voice Pedagogy with Voice Workshop. My MA studies have always been about singing and health and well-being. My specialisms in my areas of research have been mental health, multiple sclerosis, and chronic pain. As a result of my research and my work, I've had the opportunity to present at a number of conferences and events over the past few years. The first being the Voice Geek Conference, the very first Voice Geek Conference organised by Voice Workshop. I presented my research on singing for people with chronic pain, and the result of this was that I was then invited to Snape Maltings for a residency, and I took a team with me of my colleagues working on the programme, and we were able to spend a week at Snape Maltings developing the model further to then be delivered through the NHS in Cornwall. I've also presented my work on trauma and mental health for the Spheres of Singing Conference, for the British Voice Association, and for the March Network, for the Special Interest Group on Singing and Mental Health. I'm due to run a workshop for a conference for the Centre for Child Mental Health in London early next year. And I've also delivered and run my own training in trauma and mental health, informed approaches and principles for singing and voice practitioners. The Singing for Health Network is a really exciting project, and I'm really delighted to have secured funding from the lottery to be able to realise this ambition. From when I first started training to become a Singing for Health practitioner, which was with the British Lung Foundation, I trained to become a Singing for Lung Health leader, I very quickly started to think that perhaps there needed to be some network, some way for practitioners to feel connected. And as I became more interested and involved in research, I felt that there was perhaps a missing link for many practitioners who were not able to access research. So the idea for the network is really about bridging research to practice. Many practitioners can feel isolated, they're not attached to organisations, they're working on their own, and they don't have the time to be able to sift through great long research studies. So the idea of the network is to make the research much more accessible and to provide a platform for collaboration, for partnership, for sharing, for networking, things that are so valuable, and particularly during the COVID-19 pandemic, where it's put a huge strain on the whole sector. Having a network and somewhere where people can start to feel a bit connected and supported by each other, I think is going to be really invaluable. So the idea has grown over the years, and I've consulted with many colleagues over the years, and we piloted the idea of a network in Cornwall, and it was really very well received. And so now we're building the network to be a national network. It will be a membership network, a website where people will be able to access information, advice, guidance, top tips from a range of practitioners and people working within healthcare, people working in the communities. And the idea is to give very practical advice and practical tips to people, but also to be able to serve the research in a way that's more accessible, into bite-sized chunks, into stories, research stories, things that make sense to people. But the network is there to signpost and to bring Singing for Health intelligence under one roof, so it becomes accessible and easy to find and easy to navigate. So we want to work with partners involved in Singing for Health, practitioners, strategic partners, anybody that's interested in or involved in Singing for Health from the health sector. And we're really hoping that this network will grow and become a really useful tool for practitioners, for researchers, for healthcare professionals over the years ahead. When we found ourselves in lockdown due to the outbreak of the COVID-19 pandemic, suddenly our plans for the singing clinic, the Singing for Health programme, had to be changed. So we were able to take this online and deliver sessions on Zoom. My final project for my MA was to explore and examine how singing and mindfulness online could help people, could help improve well-being for people that, specifically for people that were experiencing anxiety and or depression, and perhaps that this was exacerbated by the pandemic. Research tells us that enforced isolation and a reduction in connections with other humans can have a negative impact on our mental health. So by working with this group, I wanted to see if online singing and mindfulness could help to improve their well-being during what was a very difficult and challenging time for many of us. And so what we found was that for at least 3 of the participants, they would not have joined if it had been a face-to-face physical group. They decided to join because they were in the safety and the comfort of their own home, because being on Zoom meant that they were able to mute their microphone or able to leave if they were struggling. So by offering the sessions on Zoom, we were actually able to break down some barriers and encourage people to engage in an activity that they just wouldn't have engaged with before. And we found across the 9-week programme that anxiety and depression levels decreased and overall feelings of well-being improved, and every participant reported that the programme had improved their well-being. They particularly valued the social connections with other people, the mindfulness and the relaxation, the chance to be able to stop and the chance to be able to become aware of their own body and how they're feeling, and the chance to be able to sing and express themselves through the voice and through singing. And so the reports from participants were that they were feeling much better in themselves, feeling more able to cope, feeling more resilient, able to manage their pain, and able to sleep better because their anxiety levels had been lowered. So by carrying out research myself and building the evidence base and having the stories to tell from the participants that have taken part in my programmes has been really, really effective in being able to move forward the Singing for Health agenda in Cornwall and also wider. So I've now been able to build relationships with colleagues within the NHS by presenting them with the evidence. So I've been working with the social prescribing team to develop a singing clinic programme, which we secured funding of over £50,000 to develop Singing for Health work over the next couple of years. And through the singing clinic programme, we're offering tailored and bespoke programmes for specific health conditions. And patients are referred to that by the link workers, the social prescribers or the GPs. And then we're able to report back the impacts of this work on the patients, them being able to manage their breathlessness, being able to manage their pain better, being able to get through a day without feeling high levels of anxiety, to be able to do more, and to be able to do this through a safe and enjoyable activity. Our work has also led us to working within the hospital, and the pain management team at the hospital have agreed and committed to funding a pilot. So we've developed a 10-week programme to work with people with chronic pain, and this will be a research project that will be undertaken in partnership with the NHS. So by having the examples, by having the research, by having that evidence base behind it, I've been able to forge partnerships, to be able to secure funding, and to be able to reach more people and make a difference in their lives through Singing for Health.